27th. Why don't we begin with the Pledge of Allegiance? Roll call.
Chairman Mitchell,
Present.
Vice Chair Kinner,
Present.
Commissioner Brennan,
Present.
Commissioner Danford,
Present.
Commissioner Moeller.
Present.
Thank you. And Commissioner Bory is out of town, so she is excused this evening.
Thank you very much. The next item on the agenda is just a consent agenda. Do not see anything present for that.
I actually had minutes, but
Oh.
I didn't catch it when I printed the agenda, so since it's not published, we'll bring minutes back the next meeting.
Okay then. Next, I see public hearings. Item E on the agenda. Don't see anything
No
that
public
appears to
hearings
be a
this
public
evening.
hearing. Item F, old business. Doesn't look like we have any of that either.
It's not at this time.
All right. And on to the main event. So we have item G on the agenda, which is new business. And this is 23-166 on the agenda. This is where we would consider the funding requests. And there's all the applications have been submitted and reviewed, and we'll go ahead and hear from everybody individually. I'm just going to go by the order that they are written here. Is that, I don't know if that's the way we're supposed to do it, but that's the way I'll do it. So Boys and Girls Club is listed first, so Emily, if you'd like to do the presentation.
Good evening. Thank you for having us this evening. Boys and Girls Clubs of the Valley, representing the Apache Junction Superstition Mountain branch, is requesting $35,000 in support of our academic success, healthy lifestyles, and good character and leadership programs to empower young people to reach their full potential as productive, caring adults. Our programs will empower AJ youth to make positive choices and succeed in school and life. This request is to support the staffing at our club, which is located just down the street at 2805 South Ironwood Drive on the campus of the preschool there. Overall goal for youth is to improve their social emotional development, peer and parental relationships, and academic attitudes and performance. Anticipated long-term youth outcomes include increases in social competence, school attendance, and GPA, and positive family relationships. And we will do this by employing youth development specialists and providing critical support for families, academic support, health and wellness activities, sports leagues, healthy snacks, and meals. We are the second largest meal provider outside of the school district here in Arizona, so we ensure that each kid that attends our programming out of school time does have a healthy meal and snack, and that they get their homework done and have a good time being a kid as well. So here to answer any questions you may have.
So I'm going to go ahead and open it up to the panel. Anybody have any questions after reviewing the application?
I have a couple, actually. So I noticed in the packet, in your application there, it mentioned you've got 350 members?
Yes.
For that? So I don't know if you know this or not, but how many kids in that age range would be eligible in this area to be part of this club?
Absolutely. So our clubs serve ages 5 to 18. So as long as they're enrolled in school,
Okay.
and if they're still in high school and they're 18, they can be a part of our program.
Do we
So
know-
of those members, that's what's counted. So we see on average 350 members at that branch specifically.
Do we know approximately how many kids, though, overall in this area could be served by the program if they were so willing?
So as far as like Apache Junction specific
Yeah,
residents.
like attendance, yeah.
Yeah, I don't know what our recent reports say, but I could pull that information up and follow up with you guys on that.
Have you noticed then, is the participation increasing or decreasing over the last couple of years?
So obviously the COVID pandemic impacted that, but we actually moved our location in the past year and a half, and we've already are outgrowing that space as well. So we've seen an increase of need in the community and space for the kids to utilize our programs.
Could you guess maybe in the last year how many additional, like 10%, 15%, 5%?
I would say probably 20%.
20%? 100%.
Yeah.
And then, forgive me for my ignorance, but how do the kids find out about this program?
Yeah, so we partner with our local school districts and schools, and as well as other community programs to make them aware of our programming at Boys and Girls Club. And so we just have partnerships in the community.
So the schools like have flyers or posters?
That's
or-
correct, yeah, and sometimes we go to
Okay.
resource fairs. If the city council or if the cities put something on, we put a booth up. And so it's word of mouth and making sure that we're being good partners in the community and advertising our programs.
Okay, and then last question, sorry. I think last month when someone was here, they mentioned that not much for high school participation. That's a lower percentage of your
In this
participants?
community, it is, and I think teens are one of our hardest populations to reach. I know it's one of the biggest needs too, because they also need a safe place to go. But I know here in Apache Junction, I think the youth are the biggest population that we serve. But there's certainly room to improve that and continue to partner with other communities and organizations and schools to increase that participation.
Okay, I asked because I noticed that a lot of your program talks about, job and thinking about future and
Absolutely.
so forth, where 16-year-olds probably doing that more so than a fifth grader.
Absolutely,
So,
yeah.
okay, very good,
Yeah.
thank you.
You bet, thanks.
Yeah, I have a few. So you list results, and I have no quarrel with the first three. 95% of club members were on track to advance to the next grade level. It says 80% of club members had improved health through regular physical activity. 80% of club members demonstrated pro-social behaviors and leadership traits. My quarrel is that the next one you list is not a result, it's an aspiration. It says 90% of club members plan to pursue post-secondary education. Well, that's nice. I plan to be the chair of a department in an academic institution. I went to medicine instead. So my bad humor there is to say, this is interesting, but a 5-year-old, their thing about being a police officer or a fireman is really kind of an interesting age-related expectation. You divide stuff up in one segment of your presentation into elementary, middle school, and high school. Can you give me a breakdown relative to those three groups where this fits? And since you've already acknowledged that you have a much leaner proportion of individuals in high school,
Yeah.
that's where it would be more pertinent, to be honest. But nonetheless, do you have any ideas about that?
So we have a National Youth Outcomes Survey that we do every year through Boys and Girls Clubs of America. So it's an evidence-based, it's not evidence-based, but it's something that they use across the board to measure members across the nation. And that is a module that would be given to our teen population as far as if they have plans to pursue post-secondary plans. And so that is separated on that survey. There are certain youth questions, there are certain teen questions. I don't have the actual breakdown in front of me. We can certainly look that up. And yes, of course, it is an aspiration and a goal of our programming to set them up with those resources and a plan to pursue that, but we can't enforce that in any way. But we do see a positive impact from the services that we offer, that most kids will have that in place versus those who may not have had the resources to learn that and go through that.
But do you have any way of gathering data about how many individuals apply to a community college or to EVIT? How many people take the ACTs to enter a university? How many people join the service, because you listed that as well? I mean, do you collect that kind of data to demonstrate the efficacy of that intervention?
We do not currently have active data on that. We just have what they self-report in a survey. If they join our workforce development program, which is a different request outside of this, then they do track that specifically. But just for our general membership and our general population, this is a sampling of what club members say that they get out of the club.
Okay. The other question is more specific to an area that's become much more prominent of late. That's called ACEs, Adverse Childhood Experiences. And between your proposal, which nearly killed a tree in the number of pages that were there, and someone else who had a quite lengthy one, you went into depth about looking at that. But I found nowhere where you have a scale to be able to measure that. Do you use any rubric to be able to understand how many ACEs an individual has, and therefore That obviously complicates not only their mental health, but as well their physical health and their ability to avoid gang involvement, criminal involvement, substance use, etc.
That is not something we measure directly through Boys and Girls Club. That's something that is gathered through community assessments and other research articles in zip codes, in census groups, and that is research that is out there that we use to inform the populations that we serve, but we are not tracking that specifically. We can inform that just by our conversations with families and with knowing the children themselves, but it's not something we're actually tracking. We just know that they're in high-risk individuals that we tend to serve. And we serve all youth, but this is a population that does tend to attend Boys and Girls Club.
Right. And I didn't notice that there was a specific intervention relative to finding out that people have a large number of ACE issues in their history and what can happen with that. Is that because you don't have resources readily available, or that Horizon hasn't offered you resources, or you've not tapped into, for example, the child residency program over at what's now called Valley Wise, used to be called MedPro and other things at 570 West Brown. But they have a child fellowship program, and I'm sure that there would be people there that would be interested in trying to intervene with this. I've given Jennifer an article by Dr. Charles Nemiroff, MD, PhD. He was at Emory, he's now at Texas. And he did a review of adverse child experiences studied from 1995 to 97, and as well, another study from 2009 to 2010. And 16 to 20% of those reported childhood physical abuse, 11 to 21% reported sexual abuse, 11 to 35% emotional abuse, 12 to 16% reported domestic violence in the home. And what he demonstrated is that Nemiroff discussed findings of one meta-analysis that found childhood trauma increased the risk of lifetime depression by 2.7 times, post-traumatic stress disorder by 4.4 times, anxiety by 2.5, alcohol abuse by 1.9, and substance abuse by 3.5. He added that, in addition to that, that they found that the Center for Genomic and Computational Biology found that adults aged 18 to 26 who were severely maltreated between the ages of 3 and 11 had an increased risk of depression. But interestingly enough, with the concept that I was talking to others about what's called genetics versus epigenetics. Epigenetics is when genes get turned on and off or changed by virtue of environmental issues, and that's probably this, with what's called the abnormal cortisol response. They found that those people were more refractory to classical intervention. Now, the only reason I'm bringing all this up is that just as with autism, we find that the sooner you can intervene, the better the end results are, and mitigating what these after effects are. And that's why I'm asking whether or not you have an intervention protocol to be able to deal with these individuals. Because you list them, you tend to quantify them, so.
Right, so our programs are based on all this information. So the programs that we run are high-quality programs that help to address some of these things. We are not social workers, we're not doctors, we're not diagnosing, we're not doing any of that, but we're trying to your point, catch them early and be able to make sure that they have resources. And if these are resources that we cannot provide, we do reach out to partner organizations that can provide that. We currently have a pilot program that we're running as well, where we're placing behavioral health technicians in each of our clubs. This is a 3-year pilot program, so it's going to take time to branch it out, but that is there to also help intercept any of these early signs of ACEs or mental health or anything like that, and that's just an additional thing that we're going to have at our club. So that's included. It's going to erase some of the stigma for those who need to reach out to counseling services who can't afford that, and so we do some of those social emotional wellness programs as well.
Okay, but forgive me, but I was a medical director of inpatient services at Maricopa Integrated, now called Valley Wise, 225-bed facility with residency programs in both adult and child. Behavioral health techs, the requirement to be that was essentially that you had a high school degree. And those individuals play a role, and they're mentored pretty intensely. But what I'm asking is whether or not, in light of the possibilities of the ramifications of this, whether or not you've sought more expertise via the social work department at ASU, via the Department of Psychiatry, as I said, the psychology department, the ed psych department.
So we're partnering with Terrell's Health, and so they have their own list of standards of what they need to have in the behavioral health technician, so it's more than just a high school degree. There's actual credentials that they need to have to be able to come into the clubs and perform that service.
Okay. All right, thanks.
Thanks.
Do we have any other questions? I do have a few, if none of the other board members do. So looking at the specific request for funding, there's a youth development specialist, PTE, and a program director, FTE. What's the difference between the two?
Yep, our youth development specialists are our part-time employees. They sometimes come and go through summer programming, or they're just part-time throughout the year. And then our program director and branch directors are those that are full-time and are in charge of managing and putting the curriculum together and the program schedules and things like that, and overseeing the youth development specialists.
Okay. Why are both requested at the exact same funding amount?
We're splitting it, we're dividing it amongst those, because all those staff are equally as important for us to run our programming, and so it's easier for us to be able to fund any of those positions that's needed at the time.
And if, for example, funding wasn't given, what would happen to those positions? Like if they weren't given by the commission?
Sure, we would just have to work harder and look for other partners to come to the table to fund those positions. These are essential positions, and our programming depends on the staff that we can bring to the table. And so we'd have to see less kids if we can't fill that position. If that position is vacant, we have to stay within our kid to adult ratio, and so there's those ramifications.
Mm-hmm. I know I'll be making this announcement, the community announcements part. There's an upcoming fundraiser. How much is raised typically at those, like the Mardi Gras event that's coming up?
The yesteryear event, I think, brings in around $100,000 every year. And we've also been very lucky to have great partners with Lost Dutchman Days and many other, the Apache Junction Mountain Rangers. And so we have great partners here in the community, and we're very thankful for that.
Yeah, I saw the $20,000 check that was
Yes.
awarded at the
Yes.
event for LDD. I did see something interesting, that you received funding from Pinal County supervisors, $15,000.
Yes.
Because the council does care about duplication of efforts. Is that at all duplication of efforts with the funding received from the city of HA?
We did ask for funding for staff as well, but it takes around $500,000 to run our club every year. And staffing is one of the biggest expenses, so combining that, I would not say it's duplication.
Okay.
It's a need.
Didn't have any other questions. I do want to say the application was very well written. We have a rubric that we follow. I scored it highly. Thank you for taking the time out, if you were the one that in fact wrote that. So
Thank you.
very well written application. Thank you very
Okay.
much.
Thanks, everyone.
All right, so the next on the list is the AJCDC.
We're going to be continuing on like we have in the past with the with the mission of helping people who are sideways with property maintenance folks, to keep them out of court, low income, disabled, things like that. The $6,400 that we're asking for is for the insurance that we're required to have to be able to operate. If we have to spend a lot of time raising funds, if we don't get to accomplish our goal. So that's what the $6,400 is for, so we can continue. We want to continue with our Make a Difference Day like we do every year. We're fortunate enough that we've had some good contributions from folks for tools and equipment, the shirts, things like that. So, and then we do get some donations from folks as they come across our projects or part of Make a Difference Day. But the $6,400 is for our administrative costs, for our insurance, for the board members, and for our volunteers. And with that, I'd be happy to answer your question. I'm sorry it's a long presentation, but
I have some questions.
Awesome. Oh, you do?
Yeah.
Yeah, go ahead.
What insurance specifically? Because,
It's director and officer insurance, and then volunteer liability insurance.
okay. In the application that we received, there was actually a receipt, and it says on there, insurance for 145 participants and volunteers for the event, $235.
Correct. That's Make a Difference Day.
Okay.
We have to estimate the number of volunteers we'll have so we can get a rider for that day.
Yeah, I was just saying, there's a lot of other things in there that were like A-frames, marketing materials, paint, things like that, you know. So again, I was going through the application in detail, and that's why I always thought it was for insurance. But is there any document that does specifically have that cost listed? And if there is, can you please provide that to Jennifer for us to review?
It's not part of the packet. I haven't looked at the packet for a while, so, yeah, we can do it. You bet.
Yeah, I mean, because I love Make a Difference Day. I definitely want to see it. I know the city council supports it, but I think in the interest of making sure we're accurate about how we do the funding,
Sure.
if it is just for the insurance, I see one for $235. So if you
Yeah,
can
there's another
provide,
one. It's like 800 or 900 and some dollars, but I can get all that over to you.
And that's the general liability that you must carry as a nonprofit that covers
Yep.
the board members. And then this is a rider to list those as additionally insured when they're there for Make a Difference Day. Is that correct?
Correct.
Okay.
Yep.
yeah, so,
The
If you-
DNO, the director and officer, and,
yeah, if you could have, I don't know, who's the
no, I'll get them over to you. I'll send them
treasurer?
over to you.
Yvonne Cruiser is the treasurer?
Yep, she's treasurer, she's here.
Yeah, yeah, if she can send that out to Jennifer, that'd be good to see, just to make sure we're covering that base, because,
Sure.
again, it might impact how we do
So
funding.
Yeah, you bet.
they have one for $925 for Philadelphia insurance. If I didn't include that in it was maybe on,
I did not see that one in there. I just saw the one from Special Markets Insurance Consultants. I do appreciate the receipts, but, you know, again, I took
Yeah.
classes in accounting and auditing, so I do look at things and start to add things up on a notebook paper and
Sure.
figure out what's the numbers, what do they add up?
Yep.
So, again, I always thought it was insurance, but then I saw that and I was like, well, if it is, that's what we funded for last year. But again, just want to make sure that the council knows that the money's being used the way that it's supposed to
Yeah,
be.
actually, it's the same funding we asked for last year for the same reason, yeah.
Yeah,
I think we did a little increase because we know we're gonna get
right,
with
right.
increased insurance.
So, what fundraising do you do other than what you receive from us?
Well, we don't do some fundraising necessarily. The fundraising pays for the shirts, but like Woodman Insurance, for example, they gave us $1,000, but you go to the store and buy the material and they pay for it. So we do fundraising that way, but we don't see the cash. So in other words, Ace Hardware, for example, will give us material, not money, but material. Woodman Insurance gives us material, all of our rates
Yeah.
and all that kind of stuff. So, and then our normal fundraising, as far as like Make a Difference Day, well, people like a Silly Mountain will walk by and just make donations, and we don't track their names or anything like that.
you don't track in-kind contributions as I
Pardon?
call them. They're in-kind contributions.
Yeah,
Do you
Well,
track
On the
those?
application, it says 100% of the funding is being requested from us. And then I know that the shirt you're wearing, for example, there's sponsorships and people paid to sponsor it. And I was looking for that information to see where it was, and I don't see it on the application. So I was wondering what other fundraising you might do or have access to, that's all.
we don't do any formal fundraising other than asking for contributions for equipment, things like that. Yeah, and the shirts, these are the second year we're on these shirts, so, you know, when we do a run, we'll do like 1,500 shirts, and they may last us a couple of years. Actually, some people bring their shirts from the previous year, which is kind of nice.
Do the board members do any fundraising for you? I know that I looked on there and I saw two former council members, Gail Evans and Robin Barker. Did they do any fundraising or
No, they
anything?
work. All of our board
Yeah.
members are out on projects. It, you know, we'll deal with the volunteers we can get, particularly if like Make a Difference Day. But there are other projects like, that'll come up during the week or something that is difficult to get people, so our board members are actually out there working.
Yeah.
Well, Gail got the one from Brookfield.
Oh, yeah, you know, that's right. A couple years ago, we did get the one from Brookfield for $5,000. That was, Gail got that for us. And then
Yeah.
also, we're working with it's called Rebuilding Valley of the Sun. So that's not a donation for us. We have a gentleman, his ramp collapsed when his Saguaro fell over. So we'll partner with other organizations to come in and do stuff like that. And they actually pay for everything. So all we do is solicit for the partnership. So
Yeah.
in that respect, we do, but it's mostly like Jennifer says, it's in kind.
Right. And that's not documented on your financial statements in any way?
No, it isn't, because there's no value to us. You know, we've asked them to rebuild this ramp for us, for this gentleman, and we don't see anything. They do all the work, they do everything.
Yeah, but I mean, one thing is it does show the value in the community when
To the
council
community.
sees that. I think that one of the most compelling things specifically that you bring to the table is saying, here's the value of a volunteer, here's how many volunteers we had, here's how many hours were served. That helps them connect A, B, and C, right? So those are important.
And actually, the ramp is outside our purview. We did that as a favor to him, because we don't have anybody that would be able to
Yeah.
do that.
I
So-
guess,
But it's no closed doors. We don't want to leave the guy hanging either, so.
yeah. I guess you could say I'm just showing some tough love. I do love what you guys are doing, but I
Yeah.
definitely think,
You were out there working.
yeah. And just in general, no other comments? No. So, or Dr. Brennan, did you have any?
Yeah, you know, to move on to his issue about reading, the projected budget, it says, please provide a detailed budget by quarter for each itemized expense. You have administrative costs all the way across the top and nothing else. You don't have anything for equipment, for supplies, for even the insurance that you just talked about, et cetera.
Yeah, the administrative cost is the insurance. The rest of it is, like I say, equipment and stuff, so it really wouldn't fit into that category.
Well, I understand, but I mean, so then, my point though is that those aren't genuinely administrative costs.
Yeah, they are. We don't use any of the money for any of our projects.
No, I understand, but usually when someone puts down on a budget, administrative costs, that means for the CEO, for other individuals, et cetera, for arranging for things. But then the other areas to be enumerated are the supplies that you had to purchase to do those things, et cetera. And you have indirectly done that, because you do a good job, more or less, of giving receipts. But, you know, when we talk about outcomes, you continue to issue this one line of happy citizens.
Yeah, that's,
Well, okay, but I mean, how do you grade that? How do you know how happy they are?
they thank us for doing the work.
I understand, but if you have $10 and I give you $1, you'd be pretty pleased, right?
Nope, I'd want more than that.
Well, I'm sure, but if you had $1,000 and I gave you $1, you'd think, ah, well. So the point is that the degree to which someone is satisfied or really happy about something has interesting qualities to it. You can't measure happiness. Happiness doesn't have rubrics to it. You can say that the real goal here is that you met the requirements for remediating a code violation. That would be the goal.
Well, for us, but the goal for the individual is they stay out of court.
Well, okay.
And they're very happy about that.
No doubt, but I mean, that isn't your function, though. Your function is to help them stay out of court by remediating the code violation. But your real goal is to remediate the code violation. And you do that, your outcome is measured by having, as you said at the last meeting, the inspector come by again and validate that the issue is resolved.
Right.
Okay, but you don't have that.
Well, I can put it in there, that's fine.
You know, I'm just asking you to be a little more explicit, and I appreciate it's time-consuming, and revitalization is sort of a broad spectrum, but actually you do a lot. The last time we really discussed this, you had a great case of a man who was quite enfeebled. He had a disastrous environment that actually was a hazard to the community by virtue of all of the garbage that was collecting there, and was a violation to city ordinances, et cetera, and you resolved all of those. That was remarkably admirable, and you need to be able to have, I'm not asking you to be overly publishing of what you do, but I'd like you to be able to document what it is so people know when you're having these funds that they say, well, okay, they went around telling people jokes, so they were pretty happy because they were laughing. We're going to give them $6,500 to do that.
I can be more detailed, sure.
Okay, thanks.
Yeah, I would echo that. I would just say it as, when I look at the applications that we receive, and in many cases, it's maybe because you're the smaller fish in a big pond compared to some of the size of the organizations, but the application is weak in terms of how it's written. I think you guys have consistently, every year I look at it and I read them and I'm like, more details, more meat and potatoes. Like, you know, that I see a lot of really great things written, and I see yours and I know you're doing great things. That's why I said tough love. So I don't say that to criticize. That being said, I do want to be very accurate with the funding, and I would like to see that receipt for the insurance. So however that is possible, if that could be sent to Jennifer.
And
'Cause
she's got one receipt over there, so.
yeah, because again, I only see 235. And so it's not a problem if we want to award additional for any administrative, but bottom line, we have $140,490 of requests.
Well-
We have $80,000 of funding to give.
And I
So,
want to make it clear, administrative costs, we don't pay anybody.
yeah. Oh, yeah.
None of it, we're all volunteer board members, so.
No, that's fantastic.
Yeah,
That
that's
the-
really admirable.
Yeah, and I think that you were able to connect the dots and show us the value of a volunteer, what that does for our community. And no doubt, you're here in AJ, you're making the community a better place. That's what we want with the whole program. So it's very admirable.
Okay.
So, but yeah, please do that if you can. And like I said, if I come off as being abrasive, it's just I read the application and I was confused.
Well, I think you have to realize how much work goes into these applications, and, you know, we don't have anybody full-time doing this, we do this. Things. I understand what you want, we'll do it.
Yeah, well, I mean, not to, you know, put you under the bus, I'm just saying, like, you know, we see Jason with the first-time application, very detailed, very explanatory. Like, maybe coordinate with some people in the room and say, hey, every year, we're not good at communicating our value, you know? Eric or somebody that does, you know, these organizations that have a really good detailed application. I'd love to see you guys tell that story more compelling, but that's all.
Well, and I previously suggested that there are people over at ASU in public health, et cetera, that would probably be willing to help you write grants, et cetera.
Okay.
Okay, thanks.
Yeah. Well, thank you for your time. Genesis, Trinity, or Jason and Jen. I don't know if you guys are both coming up here.
Hello, I'm Trinity Cole with Genesis Project, and we're seeking $22,800 to continue to assist funding with our rent, utilities, and navigator services for the Community Resource Center. Would you like to hear more than that?
So, why miss a beat? You know, I'm going to ask you some questions. So we already talked about you're documenting some ACES history and participants in your program, but as well, you talk about all sorts of remediation or abatement of dehydration, heat, exhaustion, and stroke. And yet, I didn't see anywhere where there was a way to monitor that so you knew what exactly you were dealing with. So, do you have a list, for example, of what are the symptoms commonly found in heat stroke?
So we actually have posters posted throughout Genesis Project in the in the kitchen area, as well as the serving area, and over at the Resource Center. All of our staff is well aware of those symptoms of heat exhaustion, followed by heat stroke. The first aid measures of, the neck, the armpits, the groin area, we keep frozen towels in all of our freezers so that we're able to rapidly assist any individuals that are experiencing the early signs of heat exhaustion. Of course, once it gets past what can be managed at that base level, we do have to call in EMTs. We're not certified to bring someone out of heat exhaustion. As you know, that's a very, very critical state for them to be in.
Or at least heat stroke. So 104 degrees body temperature is crisis time and has to be sent to an ER. But I didn't see anywhere where you even document temperatures.
No, we don't take the temperatures of our guests, no.
So why not? How can you know that they're not potentially in crisis? I mean, you have certain parameters that talk about what are classic symptoms, but people manifest those in different ways.
So generally what we see, we'll see someone that comes up, they're very flushed, they're experiencing headache, they're very thirsty. We keep emergency, they're called rapid IV type things, so it's an IV treatment in a bottle, so we're able to hydrate them that way within 30 minutes if they're not showing much signs of improvement, or if they have begun vomiting, being disoriented, anything like that, it's obviously an EMT call. So not all times are we able to take the temperature of a person and determine if they are at a critical need. We go based off of the symptoms that they're presenting with. When you're living outdoors, your temperature is going to be elevated just from living outdoors. You have not been in and out of AC at all that day. So just a body temperature is not going to tell us exactly where that person is. So based on our years of experience and going through that and having EMTs on the property, we do go based off of symptomology.
But body temperature does tell you that. I mean, it does. And they're pretty easy to do when you use a non-contact infrared temperature gun.
And we do have those on site, but again,
But you don't do that, you don't document. How do you, see, what I'm trying to find out is, how do you gauge the severity of it? Symptoms are part of it, but temperature is really critical. And it's easy to do. I mean, you don't have to touch them. And documenting that your intervention leads to some resolution, because their temperature ought to fall. The other issue is that I'm glad to hear that you use something equivalent to almost an IV solution, because it's got electrolytes in it. When people are pushed with fluids, predominantly water, they get into an electrolyte deficient state and actually go into irregular rhythms and end up dead. Mm-hmm. Not a good outcome. So, but my point would be, it really is simple, and for a while, people were using those, if you'll remember, during the pandemic, to see whether or not you could enter into an establishment. They would use the gun and say, well, okay, you don't have a temp, you can come in, okay?
and I still have one on my volunteer command center table, so yeah.
Okay, there you go. Now, I'm not gonna lie, what messes that whole parameter up is someone taking ibuprofen or something else that's an antipyretic, and then that disguises that. But all I'm asking is that there's some way to look at how it is that you might be able to do something to better document that somebody has this problem, and it actually lets you document then the results, because you say by the time they left, their temperature was normal.
Yeah, and that, I mean, if that's something that the commission would like to see, that's something that we could put into practice for the individuals that we do encounter with heat illness and hopefully never heat stroke, but yeah.
Okay, thanks.
So Trinity, one question that came up for me was with the navigator position. That's the new thing that we had last year. Obviously, it's going well.
Yeah.
Is this, like, 'cause I know the rent utilities are always been something Genesis has asked for the last few years and have been pretty good about, the city's been pretty good about funding. So if they ask me about this program, what can you tell me about the effectiveness? And then do you foresee this being kind of an item that would be asked for every year moving forward, or talk to me a little bit about that? just so I understand better. The navigator position specifically.
So the navigator position, yes, that's a position that we would like to see continue. It has absolutely taken off. We are helping more and more individuals every single month. We're having more agencies in the area that are referring people. We've had people come in with a flyer that they've received at their doctor's office. We have people come in that have received the flyer from their mental health care provider. Just today, we had someone come in from a church that had the flyer that knew we offered those navigator services. So we are seeing that the need is tremendous, and it is being utilized every single day that the navigator is available there. On days that he's not available there, on Mondays and Fridays, I'm able to fill that role as well and assist people with any of the services that they need that don't include ID, birth records, that type of stuff. But as far as the navigator goes, it is not just, I don't know the word I'm looking for. It's not just those ID services, and that's what we ran into in the very beginning, is that people had kind of this compartmentalized view that the only thing a navigator could do was assist you in getting an ID. We're getting people housing vouchers, we're getting people connected with healthcare, we're making sure people are still enrolled with access, with all of the stuff that's happening in April 1st and then again in July, as we spoke about. We have people that are receiving their mail there and are bringing their mail to us and saying, I don't understand what this means. So we're preventing them from losing their benefits, not only through DES, but through Social Security. We're assisting people to receive benefits that they didn't know they had coming to them. So we have, for instance, an individual that was 67 years old that was not receiving his Social Security retirement benefits because he thought when Social Security thinks you get their money, they'll just send it to you. Some people don't know you have to apply for those things, right? And so we think those are just things that people would know, but there's a lot of things that people don't know. So we are branching out into so many other areas that we're able to assist people with. The Apache Junction Homeless Coalition, all 17 of these agencies that are coming together every single month to collaborate and talk about the issues and how we can bring all of our resources together so that all of these agencies that are doing one thing really, really well, we don't have duplication of services, because we've now brought this coalition back together where all of us can talk and say, okay, this individual needs this, this, and this. Okay, I'm going to send them here. Oh, this individual needs that. Definitely send them my way. And so we're able to utilize that navigator service in such a huge and broad way that it's no longer compartmentalized. I didn't go to college, but that's my college word, into, IDs. And so we're just seeing a tremendous boost in the individuals we serve by providing them those.
Yeah.
Do you keep metrics on any of your navigator services?
Absolutely. So Jason is my navigator, and he keeps record of every single encounter that we have. So he would be able to tell you, he can pull those Excel spreadsheets and he can tell you exactly what services were provided, if it was an other agency referral, if we were able to get them exactly what they needed, or if we were sending them somewhere else. A lot of times we then communicate with that agency. We have a lot of follow-up so that we don't have anyone lost in the mix. So say I was to say, I'm sending Michelle your way for XYZ. And then we would follow up a few days later to make sure that you were connected to those services.
Respecting the privacy and anonymity, right? Is there any way that you could share with Jennifer, who can share with us those metrics?
Oh,
I
absolutely.
think that
Yeah.
would be great for council purposes.
Yeah, well, that was
for
actually
sure.
what I was going to say, because if
Yeah.
we award funding, this council awards funding for that, I have to go before the city council to present that. And so it'd be good to have like a note card version of what has happened because of the program.
Oh, absolutely.
So, because again, if the questions come, I'd love to have that kind of summary version.
It just started last year, is that right? Or
So
2
it
years.
started as 12 hours a week last year. It actually started in 2020 when all the other agencies were shut down or not able to see guests or what they would call clients face to face. And I called Jason with an emergency outreach of, can you please come help me? I can't keep up with this. And so we just kind of developed it together as a need-based program that we saw needed to happen.
Yeah.
Very good.
And I'll share this opinion with everybody here because I've attended the Homeless Coalition meetings, and I'll make the announcement of when the next one is at that time in our meeting. But I don't think it's something that's duplicated by any other service. As far as I can see, I don't see another position like this out there in AJ. So I'll leave it at that. But yeah, and very good application as always. Were there any other questions? So thanks, Trinity, for your time.
Thank
Yep.
you.
Next on the list is Horizon Health and Wellness.
Good evening. Sherry Debris, I'm Director of Organizational Development for Horizon Health and Wellness. I don't know how much you know about us, but we are a federally qualified health center, so we do both behavioral health services, an array, and that includes substance use and medical services under one roof. We have many locations across southern Arizona, but obviously this one is particular to our AJ site where we have our beloved Earth Day, I have Earth Day on my brain, it's this coming Saturday. Our Earth Heart Park, which was Rob Evans' legacy that he left behind. He was a former CEO when it was Mountain Health and Wellness. So our park is free. It does not require sign up. Any residents in Apache Junction can use our park. We have a lot of amenities in the park, of which Horizon has added quite a bit to recently. We have now a master gardener. We're kind of on the master gardener map. So we're an educational park now, hoping to bring in elementary students. Parks and Recs utilizes our park quite a bit. We have clubs that come out and do arts and crafts. Different meetings occur at the park, family picnics, family celebrations. Again, it doesn't have to be signed out. It's a first come, first serve basis. We have also added recently some exercise equipment along our pathways. We have a labyrinth out there. Have added a lot of trees, a butterfly area to kind of help them along the way. Anyway, and then we just added a meditation fountain as well. And so it kind of started as something that our clients could use. Therapeutically, therapists may walk along the labyrinth with some of our clients and walk and talk just to get out of the office, and it just makes them gives them a calm, I guess, if they're walking and talking sometimes. So, but anyway, it's used for a lot of different things. The limitation that we've had is daylight. It's against us. So there's only so many hours that the park can be utilized. Our garden, we now have, I think, 24 garden volunteers. Many of them are from Apache Junction. And in the heat of the summer, obviously, it's very hard to garden out underneath that heat. So many times they're trying to hurry when the sun is kind of going down, but there's enough light. So what we're proposing and what we're asking for is a $7,000 funding opportunity, and it would be to bring lighting to the park, so it would extend the hours. For families, there's some safety concerns when there's not enough light out there. Our park does serve a lot of homeless folks. We do not patrol it. We don't stop. We have had some issues because of that, but mostly it is safe. But we would like to create some more safety out there for families so that they can come and enjoy it, especially in the summertime when it is hot. Go and do the exercise equipments. 4 times around the park is a mile, and we have that sign posted now. So it's just a really nice place, but when the sun goes down, it's not quite as safe. So we've also had situations where events have had to end early because the lighting's just not been sufficient out there. And so it would extend the use of the park for everyone, and even Parks and Recs. We tried to have a fairy tale little gathering out there a couple of years ago, and they went out and kind of did a time study with the sun and decided it just wasn't a good thing because there wasn't enough lighting to do the arts and crafts and different things. And then again, in our garden itself, we'd like to increase the wattage of the bulbs that are out there, again, for safety, just so they can kind of see what they're doing and feel safe. So I think that's probably enough, unless you have questions.
So you do have lighting out there now?
We do have
around-
lighting.
Around the garden area?
Yes, we have added, we actually personally funded, we put in our budget for some lighting. It is not adequate for the events and the different activities that are going on, and so that's why we're requesting some additional lighting out there.
So the 7,000 you're requesting will enhance the lighting you already have out there?
Yes,
Is it going to be enough?
yes, we believe it is. We had a contractor come out and actually go out there as the sun was setting and during the darker hours. And he's the one that will be doing most of the work. He's the one that's putting in the 12 solar-powered lights that we're asking for. He's the biggest chunk of the $7,000 we're asking for. Very small chunk for the added wattage and the bulbs that are over the actual garden. And then our own maintenance team will be adding some other lights, just some smaller. I mean, the larger ones are obviously the contractor's going to do, so
I'm an avid gardener. My backyard is filled
you
with,
should come volunteer.
I've actually been considering that.
You
believe it or
should. It's a
not.
great group.
And I know during the summer, I do most of my gardening at around midnight. And I usually hold a flashlight in this hand and do whatever I need to do with the right hand. So I know the lighting would really come in handy with that.
Yeah.
If you have any extra light bulbs, I'll borrow them.
Yeah, well, you get one of those ones that just wraps around your head.
I
and-
tried that. I kept bumping into things and breaking it, so I'm back to flashlight.
I gotcha. Third hand.
So your proposal said that it would be pre-dawn to after dusk. So what are you expecting the hours to be?
The hours are open. I mean, anybody can use the park at any point in time. We don't really have a closing time for the park.
So it'll be illuminated 24 hour?
The lights actually will be on a timer. I do not have that answer for you. I don't know what time, I don't think we've decided what time the timer will go off, but we were going to preserve and we were going to do a shut-off valve. I do know that that was part of the proposal. I don't think we ever decided what time we would shut that off. So no, it won't be on 24 hours, but.
Okay, or what, because again, you did say that, and it made sense, really. In the summertime, it's impressive.
Yeah.
And it's cooler early in the morning, and if you have light to be able to do that, that would be fortuitous. And then again, later in the evening. But obviously, 24 hours a day would be a little wackadoo.
Yeah,
A
solar
tangent.
power usually doesn't last that long if you're doing that, so.
A tangent, because you're QHC. We are facing a really critical time now. Enrollment and validation of your qualifications to be part of Access in Arizona, the equivalent of Medicaid, was suspended during the pandemic. But Congress voted in December of last year that that is eliminated as of April 1st. What measures is the Horizon facility making to make sure that people are able, if they're appropriately qualified, to continue their benefits? Because I would wonder how many people you serve really come to you via Access.
About 90% of our clientele is Medicaid. We do have some Medicare, we have some private insurance, but majority of them are Medicaid funded. We do kind of have what Trinity was talking about. We have navigators. They're not really called navigators. They're case managers. They're social workers. So we have outreach people on our crisis team, and the outreach people, their main job is much like a navigator. They do go out and educate. They help people get on Access. So we do a lot of outreach. We also, we watch the Access reports. So as someone's possibly falling off, we actually make phone calls that are proactive so that they do not fall off, because if you do fall off, it's very difficult for people to get back on, so.
Right, absolutely. And the legislature once posited that they wanted to have every 6
Unfortunately.
months, and
Yeah.
that became ridiculous.
Yes.
Fortunately, but it's still annually, and people have to have that. But the other part of it is Kids Care, Arizona's CHIPS program,
L21?
equally has this enrollment issue and qualifying.
Yeah.
So how much of your population are children?
I would kind of be pulling that out a little bit. I can't exactly tell you what our population is, the split of that. I would say it's going to be lower than our adults. We're not really known as a child provider, although there's not a lot of providers out here, and all of our clinics are very rural. We're a rural health center. So we kind of, what we say is we serve the sickest of the sick and the poorest of the poor. So Title 21 funding, all of that. We also have some funding for adults with substance use disorder that does come from the federal government that covers those that are not even on Medicaid. And so we do have kind of some of those funding streams that help. But I would say, if I had to throw out a number, I would say 40, 60. But
Okay, so you do get SAMHSA funds.
SAMHSA grants.
Okay.
We do write for SAMHSA grants for programming, yes.
Okay, and because you're an FQHC, you should get some federal funds as well.
Yes. Oh, yes. We definitely have some federal funding in our
I
mix.
don't remember seeing it. Do you?
Yeah, I think, yeah,
Yeah, in our financial documents, you should
actually-
see.
Yours was really lengthy too, I appreciate it.
Yeah,
It
well,
was-
yeah, because we have a lot of funders. I mean, our funding comes from so many different streams. And so, yeah, our financial reports are not fun for me to look at, but
yeah.
Okay,
I believe it was probably one of the more detailed that I've ever seen
yes.
and we have to. Federal government stuff.
with everything.
Yeah.
In fact, this is all the funding
Yeah.
report printed.
Okay.
Yeah, quick question. I want to go back to the lighting.
Sure.
Actually. How many, I guess I'm just curious, you mentioned a contractor. How many bids were you able to get?
We secured, I think, 3, and this was the middle.
It's the middle, okay.
Yes,
Okay.
yes.
And then you mentioned something about events. Can you elaborate just a little bit more on
Sure I
that?
can, because I'm living it right now.
Okay.
So Saturday, this coming Saturday, we have our Earth Day Festival, and I think a lot of people are actually vendors that are there. We provide community, in fact, I think almost everyone in the room is going to be there. So any of the community nonprofits will have tables there. This is, last year was the first year I ran it, and we had 4,000 people come to, and we expected 1,500. So this year it's going to be even larger than that. It's Horizon's way to give back to the community. This is our signature event for all of our locations. We partner with the Parks and Recs, and they're a great partner, and so they kind of take a third of it. We take about 2/3 of it, and jumpy houses, clowns, stilt walkers, face painters, balloon twisters, petting zoo, you name it, food vendors, regular vendors, community vendors, DJ, all sorts of stuff. So anyway, it is our signature event. We have had other events there as well. The Garden Club
I
likes
was
to
going
do
to say,
some.
talk to me a little bit about like the evening. What would the lighting be enhancing or allowing you to offer?
Right. So in the evenings, it could be that we're really trying to build a kind of a tranquil area in the park for people to go and center themselves, whatever people want to call it. And so this would allow people to kind of have that therapeutic part of the park a little bit longer. Event-wise, because we're an 8 to 5 organization, I mean, we don't do the events at night, but Parks and Recs has asked a couple of times, and then, like I said, they've came out and realized that the lighting's just not good enough for what they need it for. And so the events that I'm talking about are usually Parks and Recs asking, or I know Jason's had his fundraiser in our park. So you just have to get out of there before dark, and now they wouldn't have to do that. So maybe more families would come out and have dinners in the park because they would feel safer as well. So,
And how big is the park?
oh goodness.
Just a guess.
I think it's I want to say 3 acres. I'm terrible
Okay.
at guessing things, but it's 2 to 3 acres, I think. So yeah, there's 4 hearts. They all come together, pointed in the middle, and that was on purpose. So it's the name Earth Heart Park. So.
I know years ago, I was involved with SACA, and we used to do the,
They did Earth.
we used to
Day.
do the, well, not only did we get involved in the Ladybird release and all that.
Oh yeah, we released 20,000 ladybugs.
But
Yeah.
are you still doing that?
Yep. Yep.
Cool.
Saturday.
Okay.
I'm scooping ladybugs on Friday.
But we used to do a boutique there,
Yeah.
a bazaar, farmer's bazaar there.
Yes.
And I know that if you do an outside event, after the event ends, you have to take time to pack down and break up. If you have no lighting, it is a pain to
Yeah.
back your car up and break down.
Yes.
So lighting would have come in real handy
Right.
back then.
Right.
Where do you scoop ladybugs from? I'm sorry. I'm inquiring minds.
You can join us if you'd like. So they come from California, 20,000 ladybugs. Ace Hardware donates them every year. And
Okay.
Parks and Recs puts them in the refrigerator, so they go dormant. And then we open up the box, literally it's a box, and everybody's got little condiment cups, and you put a little cotton ball that's wet in there, so they have a little bit to drink, and you start scooping them and putting lids on.
Who knew?
Oh, you get them all, I mean,
off topic.
yeah, if you want to really have fun, you find them all over the
Oh,
place, though, when you're
it's
done.
hilarious.
Yeah, the kids love it. They put them all over. And now that we've got a beautiful garden and extra plants and stuff, there's just all sorts of place to put them, so the parents will take them out, and they just put the ladybugs all over the park.
And you got to see them quick, because if there's nothing to eat, they'll disappear fast.
Yeah,
Because they eat aphids. If there's no aphids, they will be gone quick.
yeah.
How many events have you turned away due to lack of lighting?
That I know of, I've been kind of over this. Of course, COVID. I came on, and then COVID hit. So I would say, really, like the last year and a half, we've turned down 2 events, and they were Parks and Recs events.
So this also will help the community by allowing more things to happen.
Yeah, I think Parks and Recs would utilize our space a lot more, because they have some just super cute things, and so this was going to be a tea kind of party with fairies, and they wanted to do it at night underneath the twinkling lights, but just felt that it wasn't safe enough, and there wasn't just enough lighting. So,
And this, with a budget like yours, it's a multi-million-dollar budget, and this request comes up, did it not get covered by maintenance? Did it not get covered by anyone else? Why write the grant specifically for the lighting? Was it not something that could be done any other way?
well, we're heavily regulated, federally and governmental, and then we do write grants, but typically our grant writing is for programs. It's to bring programs to the needs of typically very rural areas that just don't have a lot of resources. And so this one, because I'm the one that wrote it, but I felt that because it does give back to the whole community. The park is free, come and enjoy it. And because we have our exercise equipment now, it just would be nice when the sun goes down and it's not so hot, that the kids can go around with their with their parents and actually use that equipment. So because this one was so specific to AJ and it wasn't programmatic, I thought that this would be a perfect one to write for you guys.
Excellent answer. And I know that Horizon has received funding in the past. It's the first year I've ever seen the grant application, but I did look back to like 2011, 2012, and there are times that grants have come through.
Yes.
Don't look at every single year's history, but I do see the report. My question is this a one-off project? Is this something that happens this year and then maintenance costs later? Are we going to see one where it's like, well, this panel broke and
No.
we're here again?
No,
And,
we'll absorb that. Horizon will start absorbing that as just part of our administrative budget. So
and if the contractor doesn't hit their bid, what's the plan?
we'll have to take out of our pocket. We'll figure it out.
And is there any risk of theft of the facility, like the solar installations or stuff, when they're put up? Is there any risk at all that are they going to be more of a permanent fixture or something that could possibly be stolen, or you never know?
No, it's permanent. Yeah, we even lock our picnic tables down out there. So, yeah,
Okay.
yeah, we have to secure everything out there. But yeah,
Yeah. Okay, that's all I wanted to know, just basic stuff pertinent to the lighting.
Sure.
But yeah, it sounds like a really excellent project, and thank you for writing this grant. It was really well done.
thank you. Appreciate that. Thank you.
And the next on the list is Other Side Ministries.
Thank you, Commission, for allowing us to come and present to you all. And I do have to say, after Commissioner Mitchell's nice words about our grant application, that we have a glaring mistake on it, which is we are not asking for $19,230.64. We're asking for 52% of that, so $10,000. So we both looked at each other when that came up, and we were a little surprised. So we apologize for the discrepancy on our grant application. So my name is Neil Lenuer. I am board president of Other Side Ministries. Other Side Ministries is really a multi-pronged group in terms of our outreach. We do outreach every other Sunday in partnership with Genesis. We help feed the homeless every other Sunday. That's one avenue of our outreach. Another is we do have a catering arm, which serves as a fundraising ability for us to help support what is actually our main mission, which our main mission is we have a class, the New Beginnings class, and the thrust of the New Beginnings class is that we want to be able to reach at-risk individuals and give them the skills to find work in the restaurant industry. Jason Taylor, who is our executive director, is an ordained pastor, but he's also a classically trained chef. So our New Beginnings big preliminary class is a 4-week class where we bring those individuals in, we give them the skills they need to get their food handler's card. We also have life skills that we teach them during that time, resume writing, how to budget. We also are incorporating some mental health programs into that this year as well. So really what we're looking for with this grant request is help in funding the New Beginnings course.
You know, I was interested. It was really an excellent presentation, proposal. The addendum, though, was that you admit that 95% of the individuals that you have in your culinary program are males. Help me understand why that skew is there. One would think that the distribution of women and men that would be in need of some skill set like that would be almost equal.
The reason for the number is it's open to anybody over 16 years of age, male or female. When we first started the program, we actually started in the city of Mesa pre-pandemic, and at that time the numbers were more female than male. Within the pandemic, our kitchen shut down. As everybody went through the pandemic, we lost our kitchen. We were able to partner with Genesis at that point. And since we've been here in Apache Junction, it has been predominantly male for whatever reason. It is open to anybody. We have interviewed both male and female, but for whatever reason.
It's skewed male. Okay. One would deduce that people that are in this position likely equally have a proportionate number of individuals that are lacking a high school diploma. Is there any collateral effort to get them adult GED preparation?
Yes, we've worked with organizations that provide GEDs for people. We also are working with CAC. If there's somebody that would need a GED, we work to get them connected to the program, much like how we help them find jobs and help them get interviews. We connect them to those programs and follow up with them and serve more as a mentor to get them along those programs.
Okay, not to cast a pall on all of this, but obviously the industry that was hit most pronounced during the pandemic was the service industry. Do you fear that even though this is well intended, that if there is a recession, that these individuals are going to be some of the first probably to suffer the consequences of that?
Speaking from my own career, being 30 plus years in the industry, there's been recessions and ups and downs, and one thing that's been consistent, restaurants continue, bars continue, people eat and people drink. Through the pandemic, one of the problems I faced was I had many restaurants and many managers that's reached out to me, and I was trying to find students and get people prepared too. So there was more people needing workers than. So at this time, I haven't seen that to be the case. And we're really 2 years past now. It seems like it's stabling more so for the industry.
Okay, great. That's good to know.
Yeah, and I would say from my own experience, which is one of the reasons why I was so attracted to Jason's work and to Other Side Ministries, is that as a young man, I found work in a kitchen, worked my way up through a kitchen, and I traveled across the country, working my way across the country, going from kitchen to kitchen. I feel like it's a tool that you can give somebody that they can always find employment. And to your point, I understand a recession, nobody's safe, right. And no industry is safe. But I feel like the ability to walk into the kitchen and say, I can do this, is something that can serve somebody for a lifetime.
Okay, great. And I take it then that even though you don't have a certification program per se, your reputation is enough of an endorsement, at least locally, that that helps people.
Yes, yes, and in our catering, it's a way for our students to gain income, and many people, I think everybody in the room has hired us for catering, so it's an opportunity for them to gain those skills and also have the community see them in action, if you will.
And that's an endorsement of you, if people in the community are asking for catering.
His food is excellent.
Yeah,
I have to say.
good. Okay.
And I would say that they do, as in the 4-week course, they do get their food handler's card.
Okay.
So that is a part of the credentialing that we do in
Right,
the
so a
first-
basic credential.
That is a
And I'm not
credential.
minimizing that, because that's more than not. And I'm glad to hear that you're equally seeking some way to enhance their education. I will own, I have a real bias. I think education is liberating, and, it gives you lots of options. And those people that drop out, as reflected in the report that I referenced last time from October of 2020 by Pima County, that said the dropout rate was a big issue for Pinell County, and they really wanted to focus on it. So the 5 most significant risky behaviors: substance abuse was number 1, alcohol abuse number 2, overweight number 3 at 44%, dropping out of school 25%, and poor eating habits. Interesting, that's kind of nebulous, but nonetheless 25%. And so it's a big issue, and in light of the incidence of people that live at below poverty level in both Pinell County, but as well in Apache Junction, I think the population in Apache Junction that lives below poverty is 13.8%, is that correct, Jennifer? Okay, I mean, that's pretty substantive.
It is.
I think our senior community is roughly around 32 to 35%.
Oh,
So,
there you go. See. All right, so, okay, thanks.
So, do you have a placement program for your graduates then? Do you partner with the local
Yes,
places?
yes, we've worked with local restaurants to help people get work. We get the interview, they need to get themselves the job, and then we support them we've helped them get shoes, if they need transportation. If they continue working for 90 days full-time, we'll buy them their first set of knives. So we mentor them through the process. The training is just one part of it, but the placement is the ultimate goal.
Right. And then you kind of said something that was going to lead to my second question. So 90 days, you help them. So how long do you kind of mentor or partner with them through there?
As long as they're willing to work with us. We want to circle back. We have people who, to pay for the program, we have people who support it, and grants like these for our students, it's 100% free. And they pay for their program through volunteering at Genesis Project. So it takes about 3 outreaches for them to pay for it. I have students that are still coming 3 years down the road, so.
Oh, okay. So it's not, it's a little trade-off there. Okay. That makes
Absolutely,
sense.
yeah.
Okay. And then how long have you been doing this then? Is it?
We started in 2019. March of 2019 was our first class, and we ran consistently for a year till March of 2020, and then when the pandemic, we was on fire for a second, and then
Right.
we adjusted.
So do people tend to kind of stick with this career, or have you found that they move into something else, or kind of
They're usually within our industry, the move-on rate about 40 to 48% people who really enjoy it and stick with it, stay with it. A lot of people, like in Neil's case, did it, younger and got the experience. A big part of us that we found coming to Apache Junction as we reevaluated what we did pre-pandemic and post-pandemic is we've added the life skills. So that portion of it, we focus on professionalism, showing up for work on time, preparedness. Those skills will move on to whatever industry they may go to or however they may work. We have some graduates that started in the industry and actually worked at a job. We found them while she went through nursing school and became a CNA and then is continuing on into nursing school. So we were a piece in that puzzle to help her, you know, move to that next step. But we hope that all the skills that we teach them, the life skills, will carry over to whatever.
Budgeting, is there anything in there?
Yes,
I was
very
going to say,
much so.
'cause, yeah, unfortunately, this is not a generous paying industry.
No, it is not. It is not to begin with.
Well, and those individuals are coming from a position where, you know, they need those skills. They need to learn to manage the money that they're not going to be making. And so we don't want to put them in a position where, oh, here's a paycheck, where to go?
Right.
We want them to use that paycheck to help them get themselves out of that situation. And I would also say, too, that we do have an advanced class. So once they go through the first class, the 4-week class, if they get into the industry and they stick with it for 6 months, then they can come back and do a 6-week advanced class, or is it 8 weeks?
6 weeks.
6 weeks. A 6-week advanced class where Jason will actually teach them to work the line. So they actually become a cook on the line. Because the position we're most likely going to get them into through the 4-week class is going to be busboy, dishwasher, you know, that beginning situation to at least get them, you know, up on their feet. But if they stick with it, if they like it, they can come back and we'll do the advanced class for them as well.
Okay. Thank you.
Thank you.
Thank you.
Oh, I'm sorry, one last question. I think you said not 19, 10. So what's the 10 for, the 10,000?
It goes towards the new beginnings class to help pay for the class, for the supplies for the class, for the food for the class.
Food, okay.
Yeah, towards the outreach where we interact with a lot of our clients and people we want to meet, for materials, office supplies, for food specific to the class as well, because we're teaching them certain skills. There's certain items that we have to have to teach them. So it kind of covers all of the costs.
Okay, thank you.
That was my question too, was that, so like technically looking at this, these items are still covered, just the amount is different?
Correct, correct. Instead of asking you for 100% of the budget, we're seeking other avenues as well, so we wanted to.
So your classes are 4 weeks long. How many classes do you run a year, approximately?
The way we wrote the grant, we are looking to do one a month
In the summertime.
in the summer.
In the summer. So basically, if you don't mind, Jason, so when I came on board, you know, Other Side Ministries was still rebuilding from the pandemic. It really took like so many of us, it took a huge toll on Other Side Ministries and the partnerships that we had. And so we really restructured our calendar March of last year so that we cater from October through April, which is the time when obviously it's the busiest here. And that money, again, helps support the mission itself. And then we focus on the class as the summer months come. We actually will be doing, it looks like, we do a once-a-month class at New Leaf, La Mesita. And from that class there, it looks like we're doing a class for them as well at our facility. But we will have a class that starts June 1st, July 1st, and August 1st, 4-week class each of the 3 summer months. I guess we actually have about 5 summer months, but the main summer months.
Okay, so 5 classes a year then?
3 that we have planned,
Okay.
not including the New Leaf class. But we're open to, you know, if we have the partnership with our other nonprofits, we're open to doing classes whenever it's possible.
Yeah, the ultimate goal, or the reason I started this nonprofit, was to do the education. So the goal is to have 12 a year to build to that, where we have the partnerships, we have the students coming in, and we have the restaurants seeking employment.
So, numbers guy, I look at the requests and there's 7, and it says outreach, food expense, supplies, meals, uniforms, office supplies, small tools and equipment, at least on this grant that I'm looking at.
Correct.
But there's no dollar amounts for each. Is there any way to revise this and get it more specific as to how much for each of those?
Oh, absolutely.
Yeah.
And that was largely put together by the banker on our board, so we're gonna.
There,
Okay.
I think an ad popped up. So this was,
There is a dollar amount there.
there's
Yeah, there's
dollar
dollar
amounts.
Okay, this
And-
one is incorrect though that I'm looking at.
Yes, yes. Well, actually, it is correct, but what I did not do was the line says what percentage of the project is the 52%. So while I'm adding up numbers, at the very end, I had a total, and I did not divide it by the 52% of
No,
the
but they
budget.
said they're still asking for $10,000, right?
Yes,
And here I say food expense 10,000. So if we're still covering these 7 items, just maybe a quick breakdown as to how much uniforms, how much meals, how much supplies. those
Oh,
things.
of the
Just
10,000.
amend.
Yeah,
amend
just
these.
to make that more clear. Again, because if this council gives you funding, I do have to present it to city council. So having that information is helpful to say, this is why this amount was decided upon by the commission if
Okay.
funding is awarded. Just random question, your headquarters is in Mesa, so, or at least, well, few things,
we have
articles of
a-
incorporation and items like that.
We have a PO box in Mesa, and we have a side office that we work out of. But we work out of Genesis Project. I have an office there, and then our catering kitchen is at
Yeah,
Amazing Grace.
that's what I was confused about, because I'm like, I see Genesis, I see everything happening here in AJ, and then I look at this and I'm like, Articles of Incorporation, Mesa, and this address, Mesa, your address is in Mesa, you know?
Yes.
So a lot of the paperwork is like 265 Gilbert Road, Mesa, you know?
And that's when I originally started
Yeah.
this. I started it out of my home, and
Yeah,
would be a
and of
good
course,
idea.
the only reason I ask is because, Meridian is the county dividing line, so we're talking about money from AJ going to Maricopa County,
No.
So I want to make sure that question doesn't come up, that's all.
No. And when
Yeah.
Neil mentioned the La Mesita class, none of the funding from this would support that. That's
Yeah. And then just the final thing, just under that same wing, the students, they're all recruited, found locally here in
Correct.
AJ. Do you have a process to verify addresses and like where
We
people
do,
are?
we do a 3-interview process, so they fill out an application just like you would at any job. We also take it from there. They have to write an essay on why they want to take the course, and we have a personality quiz. But all of our referrals come from our local agencies, like Horizon Health, Genesis Project, so they are local. We haven't done a address necessarily. We don't do a Google search, but we do work primarily with this community.
Yeah, and I knew that, I just was like confused by that, and I want to make sure that doesn't come up in any way.
Understood.
Yeah.
Good
so-
question. Thank you.
Yep, that's all. Any further questions? Well, tremendous application for the first year applying. I really appreciate you guys taking the time to do it, and I look forward to any of that revision that needs to be there so that we can better get to that consensus. So thank you very much.
Thank you.
Last but certainly not least, Eric, Food Bank.
Hi there, folks. Good evening, Chairman Mitchell and Board. I'm Eric from the Superstition Community Food Bank. We are requesting $50,000 to assist with purchasing food. That's it. Basic as can be, right?
I have so many questions now.
I mean, obviously, with the rise in food going up, everybody's seeing it. Our food drives are not going as far as they used to. Somebody that used to spend $20 and donate that food to a food drive, we're getting half that amount because they're still spending the same amount, it's just yielding less food. So our cost in food, our need for buying food has risen because of that, and the cost in food has risen. And so we are estimating that that is what we're going to need to help us.
I don't have any questions.
I noticed that you mentioned 3 holidays, and they're essentially Thanksgiving, Christmas, and Easter. Now, that's a real interesting skew. So those people that are celebrating Ramadan right now, I guess they're out in the cold?
So we're also expanding to include 4th of July this year.
Oh, there you go, fire.
So there'll be another non-Christian
Religious
traditional holiday that we can include others at.
Okay. But there's no effort to try and include other minority groups, and I have no idea how many people in Apache Junction are Muslim and celebrate Ramadan.
I couldn't answer that question.
Okay, yeah.
No.
Chairman Mitchell, I have a question.
Go ahead.
A couple years ago, I think you mentioned that dollar cash donations can work better for you because you have a buying power.
Correct.
Can you explain that?
So when we buy stuff, we buy it by the half pellet or the full pellet. So whereas the consumer will buy a box of macaroni and cheese, and I'm only using macaroni and cheese because we recently bought it, where you can buy it for $1.79, the Great Value brand at Walmart, which is the cheapest out there. We can buy that same box for about 59 cents a box. So when you talk about the consumer going and purchasing it for $1.79 a box, or us buying it for 59 cents a box, you can see that our money goes twice as far in that instance. But with other items, it's not quite as drastic, but we still have better buying power if we purchase it versus a food drive. Food drives are always going to be needed. People love the feel-good, taking their money, buying food, peanut butter, whatever it is, and putting it in a box and giving it to the food drive. People love that. Schools love having food drives that, you know, oh, Mrs. Smith's class donated 862 tubs of peanut butter. Like, they love that kind of stuff. But money goes further, especially when we buy it.
Okay.
Do you have any donations at all by Kroger?
So, funny you should ask. The mothership for the United States is Feeding America. In Arizona, there are 4 baby motherships, and all of us smaller agencies report to those entities. And so those big Feeding America, and then United Food Bank, St. Mary's, Food Bank of the Southwest, Food Bank of Yuma, they have the relationships with the major stores. And when we go to ask those stores for donations, they say, we already partner with Feeding America, or we already partner with United Food. And I think that's just because it's easier for them to say that than to have to work with 100 different food banks that want to do something in their parking lot or with them. So I have started the dialogue with United, saying, how do we tap into Kroger saying, we already partner, you need to run it up the flagpole and see what they can do for you to get some resources funneled back down. So those conversations are already happening, initiated by me, to United and then again to Feeding America. And this is probably within the last 4 weeks I've started that dialogue, because I was tired of getting stonewalled at our local level and everybody saying, oh, we already partner with Feeding America, we partner with United Food Bank. Well, how do we see some of that fruit? So I've started that dialogue.
So is there any relationship with the community college to deal with what would be called a community garden?
No. And it's funny because I'm going to talk to Sherry afterwards to see. I know there was some dialogue years ago with some of the vegetables coming over from their community garden to the food bank. But no, this is my first year in the position. I am very ambitious and I am a go-getter, and there are things that we are thinking outside the box to try to gain those partnerships. But at this point, I have not reached out to the local community college. Yeah.
Yeah, of superstition, right, okay. I just thought that might be an avenue, and that way people could participate in the cultivation of whatever they're gonna have, and thereby it could be educational as well. Because if they had a pseudo plot that was theirs, they could exchange it with other participants and enhance their take from the garden, if you will.
Mm-hmm. One of the things we're actually doing at Earth Day on Saturday is we're giving out seeds so that they can plant their own produce, and hopefully it'll grow into something that they can actually eat.
Well, there you go. I have a bunch of rabbits that would love it.
Right, in our area.
Yeah, right, yeah, out where I live. Okay, thanks.
Yeah, I don't know where I saw this, but I did see kids being presented with different vegetables and not actually knowing what they were.
Ooh.
But like they would know like what a French fry was, but not what a potato was. It's kind of crazy to see that, like the identification. So that could be a kind of a cool thing for the food bank, you know, to get the food from, but also, you know, kids, maybe the Boys and Girls Club gets involved too, and there's some kind of thing to help the kids have those things, you know?
We are such a great group of people in this room that like to collaborate with each other, and I don't see that being far-fetched, Mr. Mitchell.
Well, the library does have a seed library now, where you can go in and check out, if you get so many packages a month, if you have your library card, which is a great idea. Because it beats going down to Home Depot and paying $2 for a package of 800 seeds you're not gonna use,
Right, or better.
Pay the bill?
or that are out of date, yeah.
Right. Oh, see that?
Mm-hmm.
Oh, there you go.
I don't need I don't grow watermelons. No, I might come see you.
Okay, there you go.
Do we have any other questions from board? Well, thank you very much, Eric, for all that you do, and again, really well-detailed application, and not a lot, you know, that was left unsaid, so thank you very much.
Thank
Yeah.
you, guys.
Wow, so that's it. $131,390 of requests, and we have $80,000 to give. So I just want to say thanks to everybody for making the presentations and laying out the reasons for the funding. This is where the hard work begins for us to try and figure out what we want to allocate, and no hard feelings if we can't fund everybody equally, but I don't want to discourage anybody from approaching with those requests. So thank you very much for that work. So the next item on the agenda is information and reports. Item H.
So the only thing I have to report is the next steps in this process, and that is so that they're aware as well, is that April, the commission will go through the process of doing their funding live and in person here, and that way you will know what they're going to recommend to council. I will send you an email when that council meeting is, which is in May, and that way council does like to see you present or a representative present. Sometimes they do have questions, and this year I think they're going to have a lot because we've already had a discussion about increasing the Health and Human Services funding, but they are aware that there's $35,000 to $50,000 that is also funded through the Park and Rec Department for our seniors and transportation and meals. Then in June, council, when they finalize their budget, that's when basically, if they don't change the recommendations, then that is the amount that they will fund you.
Yeah, that's the battle that I'll fight too. I want to see them increase the amount of funding, because every year we have to take out the scissors and make cuts. And I would love to just see us be able to award everything and not have that stress. But, you know, the main thing is it going to our community? Is it beneficial? What's going to happen if this funding doesn't make it? You know, there's going to be a lot of things that we're not going to see. So I think those are compelling arguments to make that we need this in the
And
budget.
this year, the legislature, there was a bill running, still moving forward, if I'm not mistaken, about eliminating, or maybe the governor vetoed it, eliminating the sales tax through the state. So you're talking billions of dollars of money lost to the state of Arizona in sales tax, which then comes back to us as state shared revenue, which funds the cities and funds the programs, funds Park and Rec. So while they really did consider it, they were extremely nervous on how the legislature was going to vote this year, how they're going to end up on cutting that money. But I think...
My understanding is it's still working its way through the legislature, but the governor has said she will veto it.
Yeah, so we're waiting for that moment, and hopefully nothing comes as a...
Absolutely.
Yeah.
Yeah, no, it would be draconian for a lot of small communities because
Yeah.
they depend on that.
Yeah, I honestly think the bill was ran as a striker bill, so I'm kind of waiting to see, which basically means I present a bill, I'm going to say I'm going to do this, but then you don't like it, so then I say, okay, let's take out all that language and let's do something new. So that's what a wonderful striker bill is for, because I cannot see them eliminating the sales
Well, I
tax.
say we got to control what we can control, and this is one of those areas. So, so everybody has seen the presentations. We know our assignment for the next meeting, and so I look forward to seeing what the fellow commission has to say. This would be the time that we would talk about upcoming community events.
Sure.
Okay, so I want to invite everybody that cares about the homeless to come to our coalition meetings. These take place at the Parks and Rec building. There's a meeting room that's not in the Multi-Gen Center, it's next to the Multi-Gen Center. And we're back in the Multi-Gen Center. Okay, that's okay. So blame JJ. His booking was incorrect. So therefore now it is all there. So when you see him, just give him the evil eye. So yeah, no, we're back in the MGC, and it is a good meeting to go to because I will see representatives from every organization there sharing what they're doing and specifically to address homelessness. And again, I'm not calling it the problem of homelessness. I'm saying, you know, the people that are experiencing this and that what we can do to help. So it is at 9:30 a.m. It is on Thursday, April 6th. I would like to invite everybody to a couple of clubs that I'm fond of, one being the Rotary Club of the Superstition Mountains. Please come to our next meeting. It's in Gold Canyon at the Gold Canyon Golf Resort. We meet Wednesdays at noon, and we'll buy you lunch. Just come be a part of it and see what Rotary is doing. And again, Rotary is also trying to do their best to fund many of the organizations in this room. And we have our Kiwanis Club, our small but mighty Kiwanis Club. We meet next on Thursday night, March 30th, and we will be at the Salvation Army location, 605 Broadview. So please attend that if you can. And yeah, it's just a good organization for the kids. We do care about what we're doing to help the children in our community. Boys and Girls Club, I don't see Emily here, but the club they're doing an event called Yesteryear. It's a Mardi Gras themed event, and that is taking place on April 8th, and it will be from 5 p.m. to 11 p.m. It is 3301 South Goldfield Road in AJ, and I believe it's definitely a big fundraiser. Over $100,000 is raised there, so if you can put that on the calendar and attend, that'd be excellent. And Stand Up AJ has an event, which is a lot of fun. It's called the Battle of the Badges, and this is a softball game at Prospector Park. It is between the police department and the fire department. Last year, the fire department won pretty handily, so I think the police are going to be kind of motivated this year to retaliate. So should be a fun event. It is a family-friendly event. All the nonprofits are welcome to set up tables and hand out information. Just about every police officer and every fire department member brings family members and their kids, and so it's a really fun community event. Several hundred people attended the first year it was done. And there's a traveling trophy that's awarded at the end of it. So yeah, it's at Prospector Park. I don't have the address, but it is from 9 a.m. to 1 p.m. on Saturday, April 15th. So, and Stand Up AJ is an organization that's helping educate our children about not using drugs like fentanyl and other things, and just giving them resiliency strategies and things that they can make better choices with. So, but again, that's all I have here. Does anybody else have anything else? Oh, Eric has another event for us.
So the Superstition Community Food Bank is celebrating our 40th year. And so we are teaming up with Barlean's down the road, and we are having a 40th anniversary dinner, dancing, and live entertainment performed by the Barlean family. It is going to be Friday, April 21st. Tickets are $60 to attend, and that includes dinner, dancing, and all the good stuff. And then you can purchase a table for 8 for $500 if you want to attend that as well. And that is our big event coming up. On Saturday, the 1st, in addition to Earth Day, we will be at the Arizona Renaissance Festival that weekend. If you have kiddos or your neighbors have kiddos, they can get in for free if they bring 3 cans of food for the food bank. And that's on Saturday and Sunday. So if you visit our Facebook page, you can share that out, make it go viral so that we get a lot of canned food donated to the food bank. And then there is one more thing. On April 8th, Lori Blank and Associates in Gold Canyon is doing their annual shred-a-thon for us. And so you can take your private documents and have them shredded. You can make a financial donation, or you can bring canned food, non-perishable items for the food bank as well, and you can get those documents shredded. And Lori Blank has been a great supporter of the food bank for many years, and this is something she does annually for us. So thank you.
Do you know the time of the shred-a-thon?
The Shredathon is 9 till 1? Sounds right.
We'll stay till the last car's through.
Yeah.
Okay. Anybody else have any events they'd like to announce? Otherwise, Jennifer, was there anything from staff liaison report?
Nothing to report.
Okay, so with that, the next upcoming Health and Human Services meeting will be on Monday, April 24th. It will be here at the, this location, I don't know the address. Council chambers. And we will kick it off at 5 PM, and that one will be our chance to hash out the numbers and our consensus for how we're going to award the funding. And with that, I'll go ahead and adjourn the meeting at 6:41 PM. Thank you guys for attending.